I'm Benaifa Mirza, and I'd like to welcome you all today. To begin with, good evening to all our colleagues and everyone who has joined us today from India. And also good morning or good afternoon to all of you who have connected with us from various other parts of the world. Thank you for joining us for this exclusive event titled Health Talk with Dr. Mukesh Batra. Dr. Mukesh Batra is a homeopath of international repute. He is the founder chairman of Dr. Batra's Group, which is the world's first and largest homeopathy corporate. In a career spanning more than 4 decades, Dr. Batra has treated over 1 million patients, including presidents, prime ministers, and prominent film personalities, and revolutionized the way homeopathy is practiced today. Aptly known as the pioneer of modern homeopathy in India, Dr. Batra has been honored with a number of fellowships and more than 50 national and international awards, including the Padma Shri in 2012. Dr. Batra is the first Asian homeopath to be awarded honorary fellowships from British and American professional institutions, and the only Indian homeopath invited to address the Academic Pediatric Association, or APA, at its international convention. A film based on his research and clinical cases shot in Hollywood is course material for postgraduate students of homeopathy all around the world. He was also the honorary homeopathic consultant to the governor of Maharashtra. Dr. Batra has authored 6 best-selling books on homeopathy, including the most recent one, The Nation's Homeopath. And that's not it. Dr. Batra is also a homeopath with a heart, if I may add. He's involved in a number of charity and philanthropic activities, most often very discreetly, of course. We at Skål International Mumbai South are extremely proud to have such a distinguished person as our club member. Please join me in welcoming the man himself.
Thank you, Benaifa. Thank you for this wonderful introduction. I'm so pleased to be here, and I can't think of a more appropriate time or a more appropriate organization to have this conversation today.
Thank you
I believe
so
that
much.
we are going to talk, quite a lot on Omicron and also
Yes.
on the COVID epidemic.
Absolutely,
And
Doctor.
I believe that the industry that's been most hit by this is really the travel and the tourism industry and the hospitality industry.
Yes.
So I'm saying, just think of this, that 1 out of every 10 persons is employed as part of the hospitality and tourism industry in the world. So it provides something like 330 jobs, million jobs across the world.
Absolutely.
And there have been 93% or more of international borders that were shut during these last 2 years. So it almost made travel impossible and very restricted.
Absolutely.
The industry has suffered almost $400 billion in the past year.
Yes.
Now, this is the impact that COVID is happening on your industry or our industry, if I may so, since now I'm a member here, so I have to speak for ourselves, which I thought it's really very, very appropriate. So I'm very happy that you carry on this conversation, and we will talk a little bit more about COVID and of course about Omicron, the present variant.
Superb, Dr. Batra. Really looking forward to it. But I would also like to take this opportunity to welcome colleague Kuldeep Bharti, the Vice President of ITC Hotels, and our club, Skål International Mumbai South's President. Thank you so much, Kuldeep, sir, for joining us today. Over to you.
Thank you, Benaifa, and thank you, Dr. Batra, for joining us. I would like to welcome all SIMS members from India and other colleagues from other clubs and members from all over the world. Greetings and warm New Year wishes to one and all of you. I think this is first time we are meeting in this year, so I just wanted to wish everybody a very happy New Year. 2022, we were hoping that is going to be a very clean year, and we were hoping for a huge upturn in 2022. But at the end of December, we saw this Omicron wave remind us of our challenges we have faced in the past 2 years in a personal and professional lives. There is hope. There is still hope. Hope that we live with this virus, as many countries are not treating this as a pandemic. They have started treating this as endemic now. This will go with time, and that we we have to get back to our normal lives very soon. And we can't keep waiting for, some fourth wave or something to keep coming. In the travel business, it's time we all rethink our business model to bring a sustainable model going forward, involving technology, customer acquisition, and great customer service. Let's hear from our world-renowned health specialist and member of SIMS, Dr. Mukesh Batra, on health matters about this new wave, ways to have a healthy life, which you can take forward for ourselves, our family, and our friends. So to all our club members and colleagues worldwide, here is to a happy and prosperous year ahead. Over to you, Dr. Batra. Welcome.
Thank you very much, Kuldeep. It's a pleasure to be here. So I think now over to Binayfa to kind of start rolling in the questions.
Thank you so much, Kuldeep sir. And Dr. Batra, as we all know, I think in the online world, in the Zoom sessions, I cannot hear you. Can you hear me? Your camera is off, just like the way it's been happening right now. Are the most common lines, are the most popular lines. And of course, in the offline world, the fear of COVID-19 and now of Omicron has really kind of taken over our lives. So while most people are resorting, a lot of people are resorting to allopathy medicines and treatments to combat COVID-19 Omicron, how does homeopathy as an alternative medicine help?
So thank you very much for this question. And it's actually a reasonably long answer. So let me divide it into three different parts. Okay. The first part is, homeopathy helps in prevention. The second part is homeopathy helps in the early stages of the disorder. And the third part is homeopathy helps in what is called long COVID, which is, all the kind of symptoms that linger on after you had COVID. So let me first start with the first part. Now, when I talk about prevention, let me say that prevention in homeopathy has actually been there for the years, forever, from time immemorial. When we talk about the last big pandemic that happened, that was the Spanish flu, and that was in 1919, around that time. So at that time, when the mortality rate was 30% for whatever the medical systems were at that time, in homeopathy, it was only 1.03%. That was the difference. Now, if you go backwards, of course, this was the pre-antibiotic era. Now, if you go backward, you will find that even before, when there was epidemics of yellow fever, when there were other epidemics, typhus and all that, homeopathy was clearly the winner. So there's already an established kind of groundwork that at least the pre-antibiotic era, homeopathy worked extremely well for epidemics. Now let us come to recent times. So you'll find that, for example, in Cuba, there was a huge epidemic of leptospirosis. Homeopathy was very successfully used over there. And there are also clinical trials to show that and prove that. Similarly, we had, in India, we had chikungunya. And then we had, which was mainly in Kerala. And then we had also, what is called brain fever, which was Japanese encephalitis. Lots of young kids died because of that. So the Andhra Pradesh government used a homeopathic medicine called belladonna, and not a single person developed, not a single child developed Japanese encephalitis who had taken that medicine. So there are many, many examples like this. Now coming to COVID in the past. Now coming to COVID, particularly, the Indian government has recommended arsenic alb 30, which is a homeopathic medicine, to be taken 5 pills twice a day for 3 consecutive days to prevent, COVID. Now, this has been extensively used by different state governments, by different corporates, and by different companies all over India. To give you an example, for example, we have used, a lot of it was used in Gujarat, and almost 99.7% of people who took the medicine, who were in the COVID ward, did not actually.
So we cannot, Dr. Batra, we cannot hear you. I don't know.
We lost you.
So the
We lost you
WBC
for
says,
15 seconds.
okay, I'm so sorry. So I'll go back to Benafar, what she said. Can you hear me? Can you see me?
Yes.
Okay, great. So, so I was saying that, so this medicine, arsenic alb, actually has clinically proven to bring up the WBC count from 85% to 194%. So it actually builds immunity. Now, this has been very successfully used in India. And at Dr. Batra's, even we have kind of distributed over 1 crore medicines like this free of charge to NGOs, to the Mumbai, to the Maharashtra Police Force, and so on and so forth. So this is the prevention part. So this still holds good that if you take arsenic alb 30, morning and evening, 5 pills for 3 consecutive days, once in a month, every month, till the epidemic kind of blows over, this is what we should all be doing in any case, other than, of course, taking vaccines and whatever else we have to do, which we'll come to a little later. So that's the first point. The second point now, if you come to, treating at the early stages. Now, if you look at the particular epidemic that is going on now, the Omicron, what are the commonest symptoms that you find? So the first symptom that you find is a sore throat and an irritation in the throat. Like they say, gale mein kharash, that is the kind of thing that, is a very early sign of you getting Omicron. And it's very difficult to differentiate this from flu and, viral colds and coughs, because now the weather is changing in so many parts of the country. But I would always recommend that, because it's so rampant today, that if you have symptoms like this, then please test yourself or get yourself tested, because an early symptom like this could actually be an early symptom of COVID. So starting with a sore throat, irritation in the throat, with a cough. And for things like this, we have Heparsal, which is a very good medicine in homeopathy, which can be used. And I'm going to focus a little more on homeopathy because that is my area of expertise. Similarly, the other symptom that you get very commonly here is drowsiness. Also with this, lots of people feel tired and drowsy. So with the tiredness and drowsiness that you get, there are 2 very common medicines. One is Brainia, which is drowsiness with excessive thirst. And the other one is Gelsemium, which has drowsiness with very little thirst. So you can see how exact homeopathy is and how easy it is to follow once you get it right. And so these are really the commonest symptoms for. The other one, of course, is headaches, and belladonna is a very, very useful medicine for that. So this is how homeopathy helps in the early stages. So I've spoken about the preventive stages. I've spoken about the early stages. Now let me come to long COVID or the post-COVID effects. Now these are actually very, very many, and I could divide this into physical effects and then mental effects. And we'll talk about mental effects a little later on. But to talk about physical effects right now, among the commonest things that you find are weakness, and weakness lingers on commonly for sometimes 2 weeks, sometimes even a month. A very good homeopathic medicine for this is phosphoric acid. Again, when it is taken, it builds up your immunity, it gives you strength, and you don't feel so weak. So the weakness recovers very, very fast as compared to what it would linger on otherwise if you're not taking it, if you don't take this medicine. The other thing that happens really is of course, is a cough and breathlessness. This continues over a period of time, sometimes for 2 weeks, sometimes even 2 months. A lingering cough is a very, very common symptom of Omicron and COVID as a kind of after effect. And here a homeopathic medicine called Spongia is very, very useful. So like this, you see that we have lots of medicines in homeopathy for different, symptoms. And this is how we treat then long COVID. And taking homeopathic medicines is not just, it's not just effective, but it's also safe and has no side effects, which is the other advantage.
As you correctly said that, while medicines play a very important part in the recovery process, how much does one's mental and emotional well-being and state come into play or influence him during their recovery phase?
So that's a very good question. It's very, very important actually. So, there's something called the placebo effect in medicine. And let me give you an example. It's actually shown and it's believed that if you go to a more expensive doctor, or if you go to a Harley Street doctor, I'm just using that as an example, or if you go to a doctor who's very well known, there are chances that you'll get better faster and quicker. Now, why does this happen? This happens because the body starts healing itself. The moment it starts telling itself, giving positive affirmations that I'm going to get well because I'm going to see this particular specialist who's going to cure me. Of course, a lot of it is also the skill of the doctor. I'm not saying that, that's not there, and the experience that the doctor has. But the body starts healing itself the moment you start thinking positive. So the moment you start thinking negative and you're depressed and you're upset, the healing of the body slows down. It's also been shown, for example, that vitamins give you really sometimes not really too much of medical help, but they give you a psychological help of saying that I'm taking something so that I feel stronger. Sometimes, pictures on a bottle of a sex tonic, for example, make you perform better. Because you say, oh God, I am that goddess, the way I saw it on the label. So There are a lot of such examples which actually show that the mind has a very, very strong effect on the body. Now, homeopathy is mind and body medicine. And that's why it works very, very well holistically in such cases. Let me give you another example. You know, the Indian Psychiatric Association, at the start of COVID, about 2 years ago, said that there was a 20% increase in psychiatric patients who suffer from anxiety and depression versus pre-COVID times. So it's been established that when people are anxious, and you know, the commonest things, let me just, you know, also mention to you that the commonest symptoms were anxiety, depression, loneliness, and fear. Now, fear came out almost at the top. More than 57% of patients in that research that was conducted out showed that they were afraid. And what were they afraid of? They were afraid of loneliness. They were afraid of being left alone. And there's a very good homeopathic medicine which helps that. They were afraid of, there was a fear of dying. That was again a very common fear at that time, because you saw people dying around you and you said, oh, my turn could come next and I could be next, you know. So all these fears, very, very common. And there are homeopathic medicines that can help to actually overcome these fears and anxiety problems. But very clearly, anxiety and depression and fears were far more common during COVID time and still are common, even though now people have kind of, got used to it and they're not afraid so much. But still, there is still the fear of death. There's the fear of isolation. There's a fear of getting infected. Okay, and there's some general anxiety as well, which is there in the. So all of these are very, very prominent, and they can be treated through homeopathic medication.
Lovely. So, doctor, have you seen like a change in mindset, or there's been an increase or a reduction in the amount of fear that people have had, when the pandemic just broke out in 2020 versus right now, we're like 2 years into it. So have you seen some change, difference?
Yes, obviously, Benafa, because, I would just tell you that the biggest fear is the fear of uncertainty. It's the fear of the unknown. Why we are afraid of dying? Because we don't know what's going to happen to us when we die. We don't know how we're going to die. We don't know when we are going to die. We don't know what is afterlife all about. Okay. So wherever there's a fear of the unknown, that's the biggest fear. But when there's a fear of certainty, when you know that something is going to happen to you, then there is acceptance. Now, when there's acceptance, then there is less fear. This is exactly what has happened during COVID time. When it started, nobody knew what treatment, how to help, what to do, what's going to happen. People were dying around you. We didn't even know what it was all about. But now that we know, now that we have vaccination, now that we have certain social guidelines, we have certain kind of research that has been done, which shows, what really this is all about and how we could help ourselves. I think there's a certain bit of, a great bit of reduction. And also because the Omicron variety right now is not so potent or so lethal, I think people's minds are at rest and now they know that they can be treated. And therefore, there is greater calmness of mind. Having said that, there is still no, you can't just brush it off like a common cold. That's also a mistake that people are making. A lot of them are just saying that, it's a common cold. Let me just treat it. The no-vaxxers, whether they are in politics or whether they are in sports, they're still right on the top of saying we should not be vaccinated and, to hell with the world. I think that's not really correct. So we must make sure, and we should understand now that no one is safe if everyone is safe. And that's really a message that we have to learn from this. So yes, while we are safer now as compared to what we were earlier, but please understand that 2% of people are still going into hospitals. Let us understand that 0.05% of people are still dying. Now, when the numbers are very large, because Omicron is very, very infective and it's affecting a large number of people, we're talking about 3.5 lakh people in India today. We are almost touching 4 lakhs. We are talking about 1.5 million people in USA, being infected every day. So we're talking about large numbers. So, this is really the business philosophy, Vinayfa. You know what they say in business? They say, do you want a large pie, a large portion of a small pie, or do you want a small portion of a large pie? So sometimes the small portion of a large pie is much larger than the large portion of a small pie. Now, this is exactly how Omicron is. So when you're getting a small portion of the large pie, it's still very infective. There's still lots of people who can be infected. It can still affect the health, healthcare workers, completely. And I think one of the biggest things is, I think there are three impacts to this epidemic, if I may say so. The first impact is financial. We all know about how we've lost, migrant workers, how they've lost their jobs. We've seen the terrible scenes of them going back. We've seen people jobless. We've seen the economy kind of being restricted and falling all over the world. That's one part. The other part, of course, is also the mental and the emotional part. We've seen people suffering from depression, anxiety, and all that. But the third part is also the social part. We've seen isolation. We've seen education be falling back because we've seen for 2 years kids not going to school. I dare say that the development is therefore not as normal as what it should have been, because they're not interacting with people of their age. It's something which is really so different. It's such a difficult experience for children to be brought up in these 2 years. So I think there is a huge impact, not just financially, but also emotionally and also socially. And I think we need to recognize that, and we need to find ways and means how do we overcome this.
Batra, I think speaking with you is always such a masterclass on things beyond homeopathy. So thank you so much for sharing all these lovely inputs. So tell us a little about your initiative, Healing People, Changing Lives.
So, that's a byline of our company called Healing People, Changing Lives. And I've thought of it for two reasons. Number one is from my experience as a doctor. When I started setting up multi-cities practices and multi-country practices, I realized that people don't care really. It said, Binaifar, about the film industry. They say that you're as good or as bad as your last movie. So they say God sits in the box office every Friday. So if your Friday film is a hit, then your price goes up. If it's a flop, then your price goes down. But with a doctor, you're as good or as bad as his present patient, not as the last patient. So statistics don't matter in medicine at all. It's just, hearsay. It doesn't really impact. What is important is that if I'm your patient and I have to be cured, I must get all right. So every patient is important. And therefore, a doctor's job is to heal everybody. Everybody who comes in touch must find a healing solution. So the idea is that everybody who comes in touch with us, we must heal. That's one part. The second part is healing is a small part of well-being. And we don't really appreciate that as people. We need to understand that when we are talking about healing, healing can also come at a price. It can come with side effects. Do you know that every day in America, more than 300 people die of what is known as an iatrogenic disorder or a drug-induced disorder, which is the equivalent of a Boeing crash. Now, can you imagine in the travel industry, if one plane had crashed, it would make news all over the world. But when 300 people die every day of a drug-induced disorder, nobody's talking about it. So you can understand that healing, if it comes with problems, sometimes, as they say, that the treatment is even worse than the cure is worse than the disease. So if you've got very long lingering effects of diabetes and asthma, and after you had COVID, you got to think of even heart disease. You have to think of all this as well, not just getting life back. So healing people, changing lives is about not just impacting the lives of patients and getting rid of symptoms, but actually improving what we call, something which we call in our company as HRQL, which is the health related quality of life. So the humanness of life must improve. You got to add happiness to your life. You got to make sure that your life is well lived, not that you're a cripple, not that you're bedridden, not that you're living, but you're not really enjoying life. So that's how this phrase comes, healing people, changing lives. That we also believe, for example, we treat a lot of skin problems like vitiligo, for example, or let us say the psoriasis. Now it affects a lot of interpersonal relationships. Even today people say that you got white patches, you don't eat on the same table. I won't eat from the same thali as you, because they think it's infected, which is not. So there's isolation of such people. Similarly, in psoriasis, it affects interpersonal relationships. People don't get married because they have a very bad skin problem. They don't get jobs on the front desk. So we try to manage not just the treatment, but we try to follow up these treatments for some time to make sure that these people are integrated into society and they get their jobs back and they live normal, healthy lives. So that's how this phrase healing people, changing lives comes from. That not just healing people, but also changing their lives for the better. Following up the treatment till they really get well. This is one part. The second part is I also believe that, and I've always believed that, that treatment and healthcare should be agnostic to wealth. It should be universal. Everybody should be allowed to be treated. Okay, and they must have an opportunity for fair treatment, which unfortunately is not true. And therefore, what we do at Dr. Batra's is that on the first Wednesday of every month, in over 130 cities where we are in India, we actually open our doors between 10 and 12. Any patient can walk into any of our clinics on the first Wednesday of every month and take lifelong treatments without paying a single paisa till they get cured. So that's part of our initiative of healing people, changing lives.
Doctor, I was asking you that, what is your secret of always being so full of life, so zestful, so upbeat?
Well, I'm talking to people like you who are, pretty, beautiful, always smiling. That also makes a difference. I think you're surrounded by people who are happy. But more importantly, I think it's really having a purpose in life. I think the important thing about living well is to have a purpose in life. And that purpose in life is not about money, it's not about you, but it's about reaching out to other people. And you know that if you are, the more you have, the more you can give. Like we have a philosophy in our company as well, that you create wealth to share wealth. So you earn money so that you can give up more money to people. I always say that, I'm most grateful to God that, you don't have to do like this. Instead, you can do like this. So if you can give instead of wanting something back, I think you're been blessed. My mother used to say this, and there's a little poem that I like to kind of recite here, if I may. Life is an echo, all comes back. Life is an echo, all comes back. The good, the false, the true. Life is an echo, all comes back. The good, the false, the true. So give the world the best you have, and the best will come back to you.
We have a whole list of questions for you to address and answer. So we have Sandhya Shastri who's asking you, post-COVID, what parameters one should check? What all tests should be done periodically?
So actually, you need to do nothing if everything is okay with you. So again, I'm saying don't be afraid. Once you're well, you're well. Okay. But if you have any side effects of COVID, which you will know. So for example, like the commonest one is breathlessness. So if you've got breathlessness and your lungs have been affected, then you should make sure that you again, make sure that your breathing capacity, your SpO2 level is regularly checked. You make sure that you again do your CT scan of X-ray after a few months to see whether it's resolved or not, and you need to make sure that your breathing capacity improves. So you may also need to, do your lung function test, which you can do in some of our clinics, check your lung health or go to any hospital and check it to make sure that not just your breathlessness is gone, but that your breathing capacity is back to normal. So that's one thing that you can do. The other thing that happens is a side effect, not really of COVID, but mainly because of the medicines that are given, steroids particularly, then you can get diabetes, or it can aggravate diabetes. Now, if you already have it. So obviously, if you have that, then you need to check your sugar level every 3 months at least to make sure it's under control, And of course, if you have any comorbidities, which is again a new word that we've learned during COVID times. So if you have high blood pressure, if you have heart problem, if you have diabetes, these are the commonest things. And very importantly, if you're obese, if you're overweight, you need to make sure that you actually lose weight. So I think these are just the 3 or 4 things that you need to do. Otherwise, I think just lead a normal, healthy life. That's it. It's something that it was last year's dream. It was last year's nightmare. It came and went. And then just get on with it and live your life to the fullest.
Absolutely. I hope this answers your question, Sandhya. We have a question from Taranjeet. I'm suffering from high BP after COVID and also have hair loss. So any answers, solutions to that, Dr. Batra?
So hair loss is easy to explain. Blood pressure is not. I'm saying, unfortunately, I can't, homeopathy is very, very individualistic and you can't use this as a platform for personal problems because there is no easy solution. it's very personalized. So you'll have to actually go to a homeopathic doctor. High blood pressure is not easy at all, because if you don't control it, you can get strokes, and there can be other problems as well. So I would never self-treat something like that. Always go to a good doctor. But yes, there is a treatment. If you're overweight, you'll have to cut down your weight. But again, this is a misconception. Lots of very thin people also suffer from high blood pressure. And but you have to get it treated properly. And again, the medicine that you take, you kind of get dependent on them for some time. So you can't stop it suddenly, because if you stop it suddenly, then again, you can get a problem. So you have to taper them gradually. So you have to also take homeopathy and also gradually taper down your high blood pressure medicines over a period of months, not just a few weeks or a few days. And then ultimately you may be, without any chemical medicine and depend only on homeopathy. And of course, if you're able to change your lifestyle, again, blood pressure is also not so easy to understand. There are two kind of different types of blood pressure. One is essential and the other is secondary. So secondary blood pressure is always because of some other cause. So for example, blood pressure is a sign and also a cause of kidneys failing. So maybe your kidneys are not proper. I'm not talking about you, but any other patient like that. If you've got long-term high blood pressure, which is uncontrolled, it can give rise to kidney failure. So it's just good to get it checked, good not to ignore it, good to keep it under control. As far as hair falling is concerned, basically it's just getting your nutrition back, taking specific homeopathic medicines which will help you to bring your hair to reduce hair falling and bring your hair back. It can be regenerated. There's no question about it, because it's only temporary. A lot of it happens because of either side effects of the medicines you've taken, or it happens because of weakness. So, both can be treated.
Absolutely. That's lovely. I hope this answers your question, Taranjeet. Kuldeep Bharti sir has a question that there is a misconception that homeopathic medicines use a lot of steroids and has only short-term benefits. Once one stops using, the benefit goes away. So do you want to break that myth or misconception?
Yeah. So Kuldeep, all the Delhi-walas think like this, guys who sit in Delhi, that's not absolute. That's not true. As you yourself said, that
I'm not a Delhi. I'm a Bombayite. I'm not a Delhian.
I'm just joking.
Okay.
So, it's a myth. As you yourself said, it's a myth. So why is it a myth? It's a myth because for two reasons. Number one is that, let me answer your second part of your question first, because that's easily answered. On the contrary, it's the other way around. Homeopathy does not temporarily treat, it treats from the root. Okay, it goes very deep into it. It's a holistic medicine. So when you take homeopathic medicine, it's not just the symptoms that get treated, but you get cured forever. When I'm saying forever is actually a relative word, but you're symptom free for as long as you can be, So that's very clear. Like, to give you an example, for example, particularly in the case of a skin problem, if you're using an ointment, and it kind of subsides it. After some time, you stop using an ointment, it comes back again. But when you're using homeopathic medicine, you're actually using it in totality. You're also looking at the social fabric, you're looking at the emotional fabric, you're looking at, what are the pressures at work, and you're treating holistically. So when you do that, then the skin problem actually disappears and doesn't come back again. So this is just an example I'm giving you that, lots of chronic problems can actually be treated safely and surely and permanently with homeopathic medicine. So this is really a misconception. Coming to your question on steroids, that's again a total myth, because no homeopath worth his salt will ever use a steroid or any allopathic medicine in their treatment, because it's kind of them versus us in that sense, because we are opposed to using chemical treatment as a philosophy. And so if any doctor is using it, it's not correct, it's unethical, and it can easily be checked. And having said that, let me also mention here that sometimes plants have got natural steroids. They have alkaloids which actually replicate steroids, but they're not steroids. So when you get it tested in a local lab, sometimes it may show weakly positive. It's exactly like how you're doing your home test, and sometimes it can come negative, but actually you're positive. So the same thing happens also with plants, but that's not true. But there are only certain labs which take some time to actually determine whether there is chemical steroid, and you can easily get it tested in a lab, and be sure that you're taking the right medicine, and it has no steroid. But by and large, that's a myth.
Thank you.
And what happens again is,
so much.
Kuldeep, that's a very good question, because what happens is also, because people believe that homeopathy is slow. So when you're able to give a very quick result, they think they must have used something else in it, which is not true.
Yeah.
Mhm. So, Dr. Batra, we have Menaka Mulchandani who's saying happiness begets happiness is my mantra from now after hearing Dr. Batra. Saying be happy. Thank you, doctor. So that's thank you, Menaka, for this lovely message. So as morbid or cynical as I may sound, doctor, how does one prepare himself or herself for the next variant, if any, God forbid?
First of all, there could be a variant. And if not a variant, there could be another pandemic. This one came after 100 years. The next one may come out.
Doctor, we can't hear you. We've lost you, the audio. Okay, so while Dr. Batra is logging in back, if anyone has any other questions, please feel free to send the questions to us on SIMS, that's SIMS 732 PR and media @gmail.com by tonight, and we will get it answered. Thank you, Mickey. Thank you so much for joining in.
I want to speak.
You want to speak? Sure, please go ahead.
I hope Dr. Mukesh Batra is hearing me. So, is he there? Are you there,
No.
I think I'd like him to be around when I
Sure.
speak a few words.
Yeah, just give us a few minutes.
Yeah.
But we'd like to take this opportunity, Mickey, for you to share something.
Yes, Dr.
Yes.
Batra is back.
I'm back.
Okay, so Dr. Batra, this is your old fan. I've known Dr. Batra for more than 30 years. He's my hero, worship him. I also take his advice a lot. So he's a friend who knows how to romance friendship. Don't get me wrong, we both are straight. But he's a wonderful, romantic, infectious friend. And he sings very well. We must ask Dr. Mukesh Batra to heal us with a couple of his lines. And most importantly, I'm very certain that with Dr. Batra's homeopathy, soon homeopathy will become the mainstream medicine and not the alternate.
Wow, inshallah, Mickey. Thank you for those wonderful, kind words. And
so, sir, please.
Thank you.
Please.
Okay, 2 lines at the end when you tell me when you're winding up, and I will.
Yeah, a special number from Dr. Batra at the end.
Yeah.
Just 2 lines. So, what was your question? Are we ready to close or?
No, I think we have a question from Dilip Lalwani. Please go ahead.
My old friend Dilip. Yeah, what's the question?
Hi, Doc. Good evening. Good to see you. Just wanted to say it's been 30 years we've known each other, and you have been not only a wonderful doctor, but I must also say a fabulous photographer, singer, a multifaceted personality, and especially the annual events of rewarding and epitomizing the ones who have really worked hard against all odds. Hats off to you, Doc.
Thank you, Dilip. So lovely to see you and so lovely to hear you. I missed you at the Christmas party. I was not there. I was not in town. But for me, every day I meet you is Christmas.
Good to see you. All the very best. And look forward to seeing you when you're back in Mumbai.
Look forward, Dilip. Thank you.
Welcome. Bye.
Thank you so much, Dilip. So, Dr. Batra, you were telling us how to not be as cynical or morbid about the next possible variant.
The next wave. So like
Yes.
I was mentioning that it's possible it could happen, but now we are better prepared. So let me just explain this. That what happens is you have.
I think this question is jinxed.
Whenever there is a question from Ishwar that would like to be asked as
yes.
Yes. Back again. There seems to be some problem with the network, not mine.
Yes.
So with the technology. So yes. So I was saying that you have an endemic which is localized, and then becomes an epidemic, which means it spreads, and it then becomes pandemic, which means it goes all over the world. Then ultimately the pandemic again becomes endemic. That means it again gets localized only in small parts, in certain areas. And then you have to live with it. Like, for example, you have tuberculosis today. You have polio today, which is there only in 2 countries in the world, And so you get only certain pockets of areas where you'll get the problem coming on and off. Like, for example, you have a flu today. So it comes with the change of season, So it's endemic. It just happens in change of season. It happens. So this is exactly what's going to happen even for this pandemic. Is going to blow over at some stage. Hopefully very, very soon. Very, very soon. And ultimately, we're all going to live our lives back together, even without masks and normal. And some countries have already done that. They're already showing the way. So let's not worry about it. But of course, if I would just say two things, number one is that the way we could actually do better in the next round are two things. Number one is the governments of the world need to take healthcare very seriously, and therefore they need to build better infrastructure. We've seen that even in the developed countries, the infrastructure was not enough to cope with this, And number two is they need to get better HR in terms of doctors, medical staffs, paramedical staffs. We still don't have enough doctors and enough nurses and enough paramedical staff to take care of even our day-to-day problems, leave aside when you get a pandemic. So there'll have to be a kind of a focus in the next few years to make sure that more medical colleges are opened, more doctors are well-trained, and more nursing staff is made available, so that if ever something like this happens, we're able to cope with it. The other part is at the individual level. At the individual level, there are two things to look at. Point number one is building your immunity. Now, immunity is built not by taking when you're sick, but immunity is built by living a lifestyle which is healthy when you're well. That's how you build immunity. So how do we do that? We do that by sleeping well. When I was doing a research for one of my earlier books, I found that 93% of Indians are sleep deprived. So sleeping well, eating well, home food, as I said, thinking well, positive thoughts are all very important. So at the individual level, this is what we can do, and exercising a little bit. So this is what we should be doing at an individual level. And the last point is that, of course, you have to make sure that you are able to overcome your comorbidities. So if you're diabetic, if you're hypertensive, or if you're obese, you want to make sure that you get rid of these, because these are the people who actually then get into trouble later on. So you have enough time now to catch up. All of us have enough time to catch up.
Yes. Doctor, thank you so much for these amazing tips. So we have our member, Ishwar Satwani, sir, who has a question. Dr. Sahib, long back, I had taken the treatment at Opera House-based homeopathy doctor regarding my loss of hair. He treated me for 2 months, charged me very heavy, but after that he said, this is male pattern baldness. Why did he not tell me this in the beginning?
Well, so male pattern baldness is an inherent condition, hereditary, and it should have been told in the beginning. But sometimes there are also other reasons for hair loss, even in males. Like you get something called CT, which can also be nutritional. So it's not very easy to diagnose it in the beginning. But also just to let you know that now there are treatments even for male pattern baldness. I'm saying there are so many people who hereditary lose hair, males and females, but they're able to get their hair back. And this happens not just through homeopathy, but also through technology. So we have in our clinics lots of new hair growth things where you have to go once in a week and use some kind of a laser treatment and some kind of serums on your scalp, which can actually help you to regrow your hair back again. So technology has moved a lot today, and even male pattern baldness can be treated. Of course, there is always hair transplant as well. So there are many ways in which to treat it, not just through homeopathy. And it's worth to look for a solution. And I think, Ishwar, you should have asked your question by singing. You're the one with a good voice. Right? Yeah. Kuldeep, at least I know all our members well. At least I know all our members well.
Yeah, absolutely. Ishwarji, there is a special request that you also sing a song.
Where is he? He's there.
Okay.
Sir, you're on mute, Ishwar sir.
Thank you, sir. Where is your mic? There is no need of mic now. We are attending a meeting, so
okay.
I will got it.
Thank you, Ishwar. Thank you.
Thank you for the question, Ishwar sir. And as Miki requested, and I'm sure we all join him in requesting you, Dr. Batra, what better way to conclude this really lovely session than by listening to your beautiful voice?
just 2 lines, Vinayafar. This is the wish that I have for my grandchildren and also for the rest of the world. It's Kishore Kumar's old song, and I just hum 2 lines for you. And that's also the wish that I have for the whole world, especially during this pandemic time. चल के तुझे मैं लेके चलूं एक ऐसे गगन के तले जहां गम भी ना हो आंसू भी ना हो बस प्यार ही प्यार पले एक ऐसे गगन के तले ऐसे गगन के तले एक ऐसे गगन के तले. So on that happy wish, thank you very much, everybody. Thank you for joining in. Thank you for this opportunity. God bless.
Thank you so much, Dr. Batra. It's been lovely having you. We can have a separate Zoom session with just your performances, I think. Thank you so much, Doctor. Thank you so much, everyone, for joining in.
Thank you, Doctor.
Have a great evening.